Staff entering the West Wing of the White House are now required to wear masks, and anyone who gets near the president must be tested. It's a reflection of how seriously the White House is now taking the risk. Most American states are now pressing ahead with plans to loosen public health restrictions. And today, Dr. Anthony Fauci, who has served under 6 presidents, cautioned against rushing to reopen and what it could lead to. Jackson Proskow reports.
Randomized trial.
The first congressional hearing of the coronavirus era brought little good news.
There is a real risk that you will trigger an outbreak that you may not be able to control.
With witnesses appearing from their homes, senators press them on what it will take to reopen a nation with the highest number of cases and deaths in the world.
Staying at home indefinitely is not the solution to this pandemic.
The experts warned repeatedly about the risks of relaxing measures too quickly and suggested the official death toll of more than 80,000 is likely missing the true scale of the pandemic.
I think you are correct that the number is likely higher. I don't know exactly what percent higher, but almost certainly it's higher.
One Republican senator who contracted the virus himself cast doubt on those words of caution.
I don't think you're the end all. I don't think you're the one person that gets to make a decision.
I have never made myself out to be the end all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence.
The head of the Centers for Disease Control said the U.S. needs to increase contact tracing by 5 to 10-fold to prevent future outbreaks. There were warnings that a vaccine won't be ready if children are sent back to school in the fall. A worry as cases of a mysterious inflammatory illness linked to COVID-19 rise in young people.
We have met the moment, and we have prevailed.
All of it contradicts the message delivered by President Donald Trump just 24 hours earlier, as he touted the increase in testing in the U.S.
I find our testing record nothing to celebrate whatsoever.
Jackson, not many people contradict the president without getting fired. Has Dr. Fauci been sidelined, or is he still the voice of reason influencing President Trump?
Well, Donna, he's certainly seen his role change in recent weeks. He's less visible. There are no more daily White House coronavirus briefings. Fauci is, though, still working behind the scenes inside the White House to help shape policy. We should point out, though, a poll that came out today is not likely to make the president happy. It shows 67% of Americans trust Anthony Fauci. Only 36% trust the information they're getting from the president right now.
Jackson Proskow in Washington, thanks. It's hoped gradually easing restrictions will lessen the likelihood of a new wave of community transmission here in Canada. As the provinces and territories take the first steps to reopen the economy, one of the things they're watching is the reproduction rate of COVID-19, which helps predict how quickly infections can spread. Eric Sorensen explains how it works and what it indicates.
Hi, Megan, here's your purchase.
As Canada eases restrictions, the concern is the coronavirus infection will spread in the community. Countries are watching each other to see what works and what doesn't.
Cheers.
At the forefront, Germany has opened bars, shops, and some schools. Even gyms with their heavy breathing and shared equipment. But already, Germany is seeing a new rise in the spread of COVID-19.
Die Reproduktionszahl R.
The reproduction rate, R, said this health official last week, was below 1. But this week, R is up to 1.1. We are taking very seriously the reproduction factor, he says, because R above 1 is the threshold for trouble.
The R is a measurement of a disease's ability to explode in your community.
R, the reproduction number for COVID, works like this. If one infected person passes on the virus to one other, R is 1. If it's passed on to 2 others, R is 2, and that is very bad. Now, if you have physical distancing and the infected person passes on to, say, on average, just 0.5 other people, the R is 0.5, and that is very good. Here's why. The population at large, if you have 1,000 infected people, they will infect at R2 2,000 other people, and in the next round after that, they'll infect 4,000. Now, if it's R.5, that 1,000 will infect only 500, and the 500 will infect only 250. If you have 5 more rounds of infections, well, at R2, that number will climb to above 120,000, whereas at R.5, it will drop to 8. So, R below 1 or above 1 is the difference between exponential growth or the virus gradually disappearing.
Where is Canada right now? The R reproductive number is estimated at 0.66, well below 1. In fact, every province is doing relatively well, many with very few cases. But experts say it's vital to keep physical distancing.
As the economy opens up, I think we're on a good path towards keeping that reproduction number low.
As social life restarts, an arcane but simple formula, the R number, can tell us how we're doing. Eric Sorensen, Global News, Toronto.
Canada is collaborating with a Chinese lab to begin human trials of a vaccine candidate for COVID-19 here in Canada. The National Research Council has made an agreement with CanSino Biologics in China, a laboratory it's worked with since 2013. Human clinical trials of a possible vaccine are already in their second phase in China. The NRC is hoping to expedite phase 1 and 2 trials here in Canada. Chinese researchers created this potential vaccine using living cells that were originally grown by NRC scientists and that were used to develop the Ebola vaccine.
There is a lot of complementarity and expertise and knowledge that we have about this vaccine, and we are quite confident that we will be able to produce this vaccine easily in our facilities.
If the human clinical trial proceeds and is successful, the vaccine could be available for emergency use in Canada by the fall. CanSino needs approval from Health Canada to begin the trials here. It's hoped to have a made-in-Canada vaccine. The federal government has earmarked $44 million to upgrade manufacturing capabilities at the NRC production facility in Montreal. 8 other vaccines have reached the stage of human clinical trials, including in the U.S., Germany, and the UK. And there are about 100 other potential vaccines being worked on. They're in the earlier stages of development. That's according to the World Health Organization. Reaching the stage of human trials does not mean success is guaranteed. Most trials fail, and it usually takes years for a new vaccine to be approved for use. An aggressive round of testing is going to begin in Wuhan, China, where the first cases of COVID-19 were discovered and where the world's first lockdown happened. A cluster of 6 new cases of COVID-19 were discovered in Wuhan. It's feared the virus could begin spreading again in the community, so a plan is being made to test all of Wuhan's 11 million residents within 10 days.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.